I want to thank everyone for tuning in and being a part of today's discussion. And I want to encourage you to join the conversation on Twitter using the hashtag DC Maternal Health. We'd love to have you following along and sharing your thoughts on Twitter as well. I want to jump right into our questions for our wonderful panel today. Why do you think, all of you who have joined us today on the panel, why do you think it's important for young people to be active and vocal in advocating for maternal health? If you all could share just a few insights on why do you think this is important?
I can go first.
Yeah, thank you.
So I think it's important because maternal health is an issue that affects every single person. We all came from women. We all have women in our lives. We all came from moms. So it's not just an issue that affects a certain demographic. It'll affect all of us. Men who are planning to have babies with women, men who are planning to adopt, and vice versa. So it's not just one thing or one issue for one person. It affects us all, which is why it's so important for us all to advocate for it.
Thank you so much, Maddie. And Joseph, I don't know if you want to provide your comments there as a father coming to this issue.
At this very moment with that topic, I do not have a comment.
Okay, no problem. No problem. We'll let you gather your thoughts. Gotcha. Natasha?
Yeah, hi. So just to piggyback off what Maddie said, I think that is very important. And over the course of the next 3 days, we're going to have the opportunity to hear from all of these young people on the panels, and we're going to be able to hear their experience. And I think it's so important that we also take note of their observations and recommendations. We want to encourage, continue to encourage our youth to have a voice and be active in the community. It sets a tone that they are here and that they're present. And it reminds the community about their personal goals. So hopefully through advocating, they can get some of their personal goals accomplished.
I love that. I love that. Kaneyce, anything you wanted to add?
I believe that maternal health is important because we never know what the next young mom may be going through. And if that person is able to speak up and help that they may need and not go through certain things by themselves, I feel like it could be a helping hand through the community.
Absolutely. And the work that we do at Generation Hope, helping teen parents get their college degrees, we are so in support of making sure that young parents and their voices are included in the maternal health discussion. And it's something that I think has really been missing. I'm so appreciative that this forum is providing a space for us to include this voice and the youth voice in general in the maternal health discussion. Kaneyce and Joseph, I think that's a good segue for us to talk about, if you can each share a little bit about the maternal health barriers that you face as young parents. If you could talk about access to prenatal and postnatal care, health care in general, housing, nutrition information and resources, anything that really sticks out to you in terms of your ability to access maternal health supports as young parents.
You like to go first?
You want to go first?
You.
Okay. Well, for myself, I think that it's important for us to have access to transportation because with the COVID going on, it's much harder now because now they're especially prioritizing who receives transportation to and from appointments. So that means that a child may miss their shots because their mom can't afford to take them to the doctor, or they may not have bus fare or train fare or car. Also, I feel like just having somebody to educate us on keeping ourselves up while trying to maintain our children, while trying to maintain our children's health is also helpful when it comes to maternal.
Absolutely. I can definitely speak from experience as a young mom myself, just getting to doctor's appointments without reliable transportation when I was pregnant was such a huge hurdle and an issue. And I remember missing appointments. And certainly after your child is born, that continues to be a challenge. But as you pointed out, particularly in this global pandemic, transportation is even more precarious and difficult and challenging. So such great points. Joseph, anything you'd like to add?
In my case, I really didn't have too many issues. If anything, it was more so on our end of being consistent with asking for help. When Jacayla was born, we had gotten to this program. I think it's Upper Cardozo or Cardoza, something centered like right outside of Columbia Heights. And I remember being a part of that program. They provided us with so much with WIC and what is it? The Pack and Play, something like that. I can't get the right name, but it just provided us with so many resources. So, like I said, if anything, it's just more so on us being honest with ourselves and saying, "Hey, we need help," because they were definitely willing to give.
That's great. I'm curious, just as a follow-up, as a father, did you feel like you were able to be fully connected to the experience, like the pregnancy, and did you feel that providers really included you in that experience?
For the most part, before, let's say beef happened, before that happened, definitely, like it was a mutual ground of acknowledging both the mother and father.
Great.
But, when drama starts to happen, I'm not going to say people pick sides, but you got to take care of the mother. And I totally understand that. That's the number one responsibility, to make sure she's okay, to make sure she's, able to, support herself, and so she can support the kid as well. But yeah, I don't know. It's no like malicious intentions or like, I guess, negativity towards the situation. It's just, things happen.
Good. And just to clarify, beef between you and your daughter's mom,
Yes.
Not you and providers.
No.
Gotcha.
Yeah,
Okay, gotcha. No, that's super helpful, because I think also another voice that we don't always include in the maternal health discussion is the voice of fathers. So thank you for that. Natasha, what role can providers play in increasing access to maternal health and resources?
So I did want to piggy off back really quick, because I think that the family structure is so important. And just on the front line, that's something that I'm seeing. So DC is doing a lot of work addressing different barriers, such as affordable housing and mental and physical health. But I think that something that I'm seeing is a lack of support from the people who our young parents care most about, and that's their family. So just piggybacking off of what Joseph said, even when there is conflict within the relationship, I think that something that we can do as a community is just to make sure that we continue to support the family structure as a whole, and just realize that need for a connection, and especially during this time of isolation, is so important. So we just have to make sure that we continue that role.
So true.
Yeah, but so as a provider, we have the opportunity to work with our families on the front line, and being able to see and address any concerns or challenges. We also have that opportunity to work in the community with physicians, with partners, and our role is to act as that liaison. So we want to be able to address those tough questions and tough issues and bring them to the table, so that everyone's concerns are heard and that resources are in place and put out. So, for example, Sasha Bruce, we have multiple safe homes, outreach programs, and prevention and education services. And we're located in Ward 7 and 8, where there is currently the highest maternal and infant mortality rates. So it's so important that we continue to support those efforts of maternal care programs and advocate for healthcare facilities in those areas where there are high rates of mortality.
Absolutely. It's wonderful to see that presence where it's needed most. Curious, just to build off of the kind of the young parent piece that we have here. curious if you're seeing a reluctance from young parents in accessing any of your services, or any distrust around, care providers is something that we know, particularly for young people of color and communities of color that have been kind of marginalized from the healthcare experience. Are you seeing that, and how do you all overcome that?
Yeah, I actually am, especially amid of COVID-19. It kind of resurfaces some of our ideas and beliefs that there is a system out there that is against us. And that's how our young people are feeling right now. And we have seen that. There was also a report done that spoke to that distrust of the medical providers is there. And that's one of the things that are preventing our young people from getting the care that they need. So for me, for example, we actually addressed this issue very recently, and I think that it's important to inform and educate. So we will have groups with our young people and have a dialogue about what is being discussed in the healthcare field and what are their beliefs, and how they can vocalize their beliefs and be heard and come up with a resolution so it doesn't deter them from getting well visits if they're having issues with things like vaccinations. So we just encourage that relationship between the young people and the healthcare providers because they have a right to be heard and their concerns are valid.
I love that. I love that open dialogue and support for that. Maddie, I want to shift and talk about what role you feel that young people who aren't pregnant or parenting currently play in advancing maternal health and maternal health access. And as a follow-up or a second part of that, why should young people get involved in this issue?
Well, I think the role that people my age, younger or a little bit older play is that we are the next generation of leaders. So we're going into college. I'm applying to colleges right now. We're graduating from college. So we're kind of going into the real world, and what we say and what we care about matters, and it will influence future policies and how our country works in the future. So I think it's really important for young people to be passionate about maternal health. Like I said earlier, it affects every single one of us. Because we all come from women, especially Black and brown kids, because our mothers have it so much harder and worse than a lot of our white counterparts. Also, I think we can start with education and awareness. So I'm really vocal about maternal health just because it's not something that a lot of my friends or anybody I really know my age knows about. When we think of women dying in childbirth, we think of things that happened hundreds of years ago and there was no modern medicine, no technology, but the reality is it's still a very real problem, especially in the US, where it's one of the highest rates in the entire world. And then I think just kind of learning how to advocate for your own health in and outside the doctor's office, because I know a lot of women, especially Black women, don't get treated fairly by doctors. So learning how to speak up and kind of say like, no, I'm hurting, or that doesn't feel good. Things like that, advocating for what you deserve is really important. And your second question was how youth can get involved.
Why should they get involved? But I think that you,
I kind of answered that.
Yeah, you did a great job. And I think it's so important, like you said, that that young people come to this issue and know more about it, and that we raise awareness across the board. I think a lot of times when we think about maternal health, we are often kind of thinking about it in a very narrow view, but so much happens in the womb, and there's so much that determines for that little one, how that mom is taken care of during that critical phase of pregnancy, and shortly after has so many implications for that child years later. So it's an issue that we all should care about and be knowledgeable about. So I love that you're such an advocate. Let's talk about barriers and challenges, and what are some of the issues that make thriving hard for young parents and families? And Kaneyce and Yusuf, I know that you guys are young parents and we're young parents. So if you want to speak to that, I'll toss it over to you.
Okay. Can you repeat that question one more time?
Yeah, absolutely.
So I can make understand it.
Yeah, no problem. If you could talk a little bit about the barriers and challenges that make thriving hard for young families and young parents, some of the things that make it difficult to be a young parent trying to provide and take care of your children.
Okay. For myself, I'm a parent of 3 young boys, and I could say not having a stable home before I was introduced to the Social Boost Transitional program was one of the biggest barriers I had. It's kind of hard to focus when you're trying to get on the right path with your life while not being in a consistent space. So going through the shelter and being placed into the program and having my program manager, Miss Natalia Harris, give me an opportunity to really build my independence and show myself that I could be more than just a street statistic. I could be more for my boys. It really gave me an opportunity to start wanting to thrive. And I ended up enrolling in the college for computer science a few months ago. So I'll be working on my bachelor's.
That's so exciting. So exciting, Kaneyce. I love that. And I should mention Joseph is a former scholar and alumni of Generation Hope as a young father who we supported in his pursuit of a bachelor's degree. So Kaneyce, we should definitely connect after this to talk about the supports that we can offer as you're working towards your bachelor's degree. Joseph, anything you'd like to add? I think Kaneyce raises a really great point about basic needs, and things like food and housing are so critical for young families in order for them to thrive, and so connected to maternal health. Anything else that you would like to add?
It's quite a few. I would say definitely one of my biggest barriers that I'm still dealing with to this day is mental health, dealing with depression and anxiety and just everything within an umbrella of mental health, dealing with that. Also, to briefly mention, on the verge of being homeless, almost being homeless.
Mm-hmm.
I remember, I think it was a senior year for Howard, and, situation at home was just very rocky. And it wasn't until the very last 2 days, I think, before school started, you guys came in, was able to talk to the landlord, get me a place. And, I've been fortunate for that. But if I can just highlight one, it would definitely be mental health, just dealing with that on a daily basis. Some days you wake up being able to say, I love myself. And then there's other days you're waking up and just like, why am I dealing with this? And it's like to deal with that, plus being a parent, and it's just to even have like not even 2-parent household, but to have 2 different places where my child is being brought up. It's just so much that goes into it. But at the end of the day, taking advantage of the resources that's given at Howard and to GH as well, being able to talk to a therapist or a guidance counselor to just say, like, this is what I'm feeling. I'm not okay. Like today I feel like crying. Not today, but for an example, like today I feel like crying. So, just being able to, admit when you're okay and not okay and when you need help. I think that's going to be one of the biggest things that I may just be reoccurring, just being able to express like the vulnerability of needing help.
Mm-hmm. Yep. I'm so glad that you raised the mental health piece, because it's so connected to maternal health and how families are doing, how they're thriving. And I think it's another topic that we don't talk about enough. So I love that you're honest and open about your own experiences, Joseph. It benefits many of us, and something we need to be talking about more when it comes to young families. Natasha, anything you'd like to add in your work with young families in terms of hurdles and challenges?
I think that they hit it on the head. And what I heard mostly was that support. As I mentioned, if not from families, then the communities. I think as partners, that's our responsibility, is to provide that support so they can get out of that survival mode and feel comfortable to think about long-term goals, such as health and mental health, maternal health, and physical health. So I think that is definitely a good point that they made, some of the barriers they're facing.
Great. Yeah, absolutely. And it's certainly in line with what we see at Generation Hope as well. Natasha, back to you for a moment. If you could talk a little bit about, we know from what Kaneyce shared and Yusuf, and just what we know about young families. Can you talk a little bit about your work and the housing that you all provide, and what you're seeing in terms of the impact it makes for young families, and the challenges that you might be running into in providing that housing?
Sure. So I'm actually the program manager of a transitional housing program. So we serve young single mothers ages 18 to 24 with one child. So they're new mothers and their children are between the ages of 0 and 2 years old. We provide housing. So that's the main service that we focus on, as well as case management. So being able to provide housing, first of all, takes care of a lot of their physiological and basic needs, right? Such as just warmth and clothing, food and shelter. So that's what we focus on there. And then with the case management, we work on different life skills. So maternal health is definitely one that we focus on. We have many groups to discuss some of the barriers and challenges, and also just kind of connecting them with resources that can assist them in aid. And I have found so far that the young people that I work with, because we're not the only transitional housing program, so Sasha Bruce has many housing programs that work with families and single young adults. And a lot of things that I find when I work with the youth is that they do appreciate the support that they're getting, and they appreciate the shelter, so they can have time to make decisions about their life and their long-term goals. And we've seen a lot of success from our young people who are leaving. I know Olaiya's Cradle has 100% exit rate into permanent housing situations, and as well as other transitional housing programs with Sasha Bruce. So we're able to tackle those needs and those barriers so they can transition and live independently.
That's awesome. And I think, Kaneyce's story about now having the mental space and the literal physical space to be able to focus on earning a bachelor's degree, I think is such a testament to how impactful housing is, and how connected it is to the well-being of mothers and families, particularly young families. So love that work, and really cannot overstate the importance of housing in all of this. Maternal health access and outcomes is a racial justice issue. And I know that's something that we're talking about more and more, particularly in the district, but as a national conversation around maternal health. For example, we know that Black American Indian and Alaska Native women are 2 to 3 times more likely to die from pregnancy-related causes than white women. Why is it important to name that? And what can we do to ensure more mothers of color survive and that all families are healthy and thriving in DC? And I will toss that over to you, Maddie, because I think you touched on this a little bit, and just the importance of this work for Black and Brown children and families.
Yeah, so I think it's important to know the history of the American healthcare system, and know especially the racist history of it. And just kind of knowing that going through life as a person of color in America is very stressful. It's very traumatic. And that will alter the way your body responds. That'll alter the way that your brain works. It'll alter the way you respond to certain medications and certain kind of health practices. So knowing all of that, it makes sense as to why women of color have worse outcomes than white women. And I think that means that we really need to focus on dismantling the racist healthcare system and putting more funding into programs that will help Brown and Black women of color, especially getting proper food, getting prenatal and postnatal care, expanding Medicaid to cover them for over a year, not just 60 days, to prevent that maternal mortality. I think we can start with just education and awareness, because I know there are a lot of resources in DC, but I know a lot of young moms, or just moms in general, may not know that they have access to those resources. And then just education on just maternal health in general, I think could be very beneficial. And I think that kind of starts in middle and high school. And this is a little bit off topic, but I think the sexual education program in the US definitely needs to be updated and better, because I know for me, I'm a senior in high school and I've never had a sex ed class.
Wow.
And I go to, my school likes to call itself very predominant, very prestigious, very, rigorous. And I've never had a sex ed class. And I think that's very unfair because I've had to learn everything myself or from my parents. And so I think kind of starting with education at a young age will be very beneficial to maternal health outcomes in the future.
Wow, thank you so much for that. So many great things in that response. Anyone else who'd like to add to this, the component of race in maternal health?
Yeah, I'll just throw some facts out there just so we can see why it's so important to have this discussion. So according to the Perinatal Health and Infant Mortality Report, Black and Hispanic mothers face higher rates of pre-pregnancy risk factors. So those risk factors include smoking, obesity, diabetes. And then Black mothers experience higher rates of preterm births and low birth rates compared to white Hispanic mothers. And this study was taken, is based off of the residents who are residing in Ward 7 and 8, the young parents there. So we must take notice of what's happening in our community. And that is why, one of the reasons why, Sasha Bruce is present in Wards 7 and 8, where these statistics are there. And I think that it's just important that we just continue to advocate for more community health workers in those areas and access to prenatal care, because it is real. And unfortunately, Black, Brown, African Americans, we are affected highly in these areas. So it's important to have this discussion.
Yeah,
absolutely. So connected to the national conversation that's happening right now around racial oppression and our country's history and legacy of racial oppression, and the maternal health piece is a huge piece of that conversation that we need to continue to elevate. I want to circle back to something that Maddie touched on, which is the role of education and schools in the maternal health discussion. And I'm curious, what can institutions do, K through 12 or higher ed, colleges and universities, to be more supportive of maternal health access, and also or in helping young parents and their children succeed in their educational goals? So that's a big umbrella of a question, but I think there's definitely a role for both K through 12 and also for colleges and universities in this work. So I'll open that up and see if anyone has any thoughts there.
I'll then on the table. I feel like for everybody that's in school, if they were to open up some more like Unity Health Centers inside of the school, like Baloo has, and for the young teen moms, daycare centers, because I know Baloo has a daycare center also. If they were to open up more programs like that throughout the schools, or at least have them close enough to the school that the parent doesn't have to travel far apart. So if the parent has to drop their child off in Northwest, for example, but their school is in Southeast, either the child, and they get fed up enough with it, either the child isn't going to make it to school or the mom isn't going to make it to school. So if it's close enough and accessible enough, then I think it will motivate young parents to want to stay in school and keep their children close to them. Because I would love to go down the hallway and be able to check to see if my child is okay. Or just knowing that my child is in the same building, I would feel better about sitting here doing work all day or working.
Yep, great points. And I think childcare is such a huge issue and a huge hurdle for for parents, period, but certainly for young parents, just the affordability and the access of it. So when we think about providing more childcare supports in schools, I think that's a great point, Kaneyce. Others want to chime in on what K through 12 or colleges and universities? Joseph, I see you with your hand up.
Colleges. So we briefly talked about this before the stream, but you know, I would definitely recommend that all colleges put this on an application. The question, you know, are you a parent, or, you know, are you expecting? Once that data is collected, you send it to the right resource, whether that's the, you know, like guidance counseling or financial aid. Like, there's so much that can go into this, because even financial aid, all these schools, all the money you guys get, come on, you can put something aside for us, give us a little grant, whether that's $1,000 a semester, like that can go pretty far, especially as a young parent and you're in school, that go completely far. But, you know, to be able to have that, having more images of us representing us. I remember, you know, Howard is this most prestigious school, shouts out to him, I love him, but I have yet to see a poster where you see a child, a mother and a child, or a father and a child. You only get to see that individual success, and I mean, that's great. But I also need to see myself. You know what I'm saying? Like, I see the representation, but I still don't see myself. I don't see my child in that vision. And so, you know, this is one thing I was trying to work on before I graduated, but I still do have time since I still work for Howard.
And you're an active alumni.
Indeed. But yeah, we definitely have to see the representation, the finances, and just to ask that question, because I guarantee you a lot of these student parents will feel much more comfortable being able to say, hey, professor, I have a kid. That, like, even thinking about that, being able to take that information, look at the classes they're going to take, send that information already to the professor. So when that person approaches the professor and say, hey, you know, if something pops up, oh my God, you already know my situation. Well, that's so nice. You know what I'm saying? Like, those things, like, yeah.
Yeah, absolutely. And Generation Hope has been doing this work and helping teen parents earn their college degrees in our region for the past 10 years. And to your point, Joseph, there's a ton of work that needs to be done in higher ed to better support student parents. There's almost 4 million, or more than 4 million student parents across the country. About 1 in 5 undergraduate students is parenting, but most colleges and universities do not track parenting status. So that's a great place to start. It's hard to support students when you don't know what their situation is. So that's a great point.
And I also have to shout out to the professors who understand, who you'd be like, you know what, bring your child to class. Like, it's okay, I got him, he or she. Shouts out to you, professors, because we adore you, we appreciate you. To the ones that don't understand, teach his own, okay? Teach his own.
Hopefully they're listening, and then now they're going to start to think differently about it. That would be great. Anything else, Natasha or Maddie, on what schools can do?
I just think having a stable, just wellness, health, sex ed program in all schools, public, private, charter, I think that would be really beneficial. Even past pregnancy and sex and maternal health, just teaching kids about their own health and about just kind of basic hygiene, even when they're in like 2nd or 3rd grade. Things like that can go a really long way. And I know I would have really appreciated that when I was in middle school. And like everyone was starting to get their periods, and I was like, oh, what is this? Like, nobody kind of knew what was going on. And so I would really appreciate if I had a person or at school that I could go to and talk to about that. Even though it's not necessarily maternal health related, that did a lot. That would have done a lot more for my mental health, like we were talking about earlier. I just think we need a more stable sexual education program in the country.
Yeah, and I would say I think it's totally related to maternal health, because it has to do with how we feel about our bodies and how comfortable we are talking to people about changes that might be happening with our bodies. And I know when we talk about young parents in particular, we come across so many young parents who hid their pregnancies for a long time because they didn't feel comfortable talking about their bodies, and they worried about the stigma associated with being a teen parent. So I think 100% it's connected to maternal health, is making sure that we're educated about our bodies. We feel comfortable having those conversations. We have go-to people in our community, in our schools, that we can talk to about all of those things. So really great point. Natasha, anything you wanted to add?
Sure. Just from an advocacy point of view and being a provider, I think it's so important that we inform the youth of our services. Like Joseph said, if we know young people are parenting or expecting, we should inform them. So New Heights is a program that is assisting expecting and parenting young people who are in high school. They actually work with the DCPS. So you should be able to find this program in those schools in DC. They assist with those common barriers such as childcare, and their mission is to improve attendance, improve graduation rates, and prevent subsequent pregnancies and prepare students for the workforce. So there are people in the schools that can assist. And I think that it's so important that we're vocal about these services so the young people can know that, hey, I can go somewhere and get some assistance. Also, in regards to the education front, so there are school-based health centers. There are 7 total in the schools in Washington, D.C., and they provide primary and preventive care services right in the school. So they should be working with the parents. If they have children, they can receive those services during reasonable hours, such as their lunch period or before and after school. So I just think that it's so important that we continue that discussion. And lastly, with Sasha Bruce, we actually have a teen outreach prevention program that are also in the schools. So they talk about what Maddie was saying, having those dialogues even prior to pregnancy, just having healthy relationships, healthy hygiene, safe sex. So they have those discussions, and we should all know about those and be vocal about it.
Awesome. And I love that you highlighted New Heights. We actually partner with New Heights in being the next step after high school for the young parents that they serve. So shout out to New Heights. Mm-hmm. We love our partnership with you and the work that you do. It is now time to open this up for Q&A. And while we've been talking, we've had some really great questions come in from those who are listening. And so the first one is, what's the easiest way to advertise critical resources, knowledge, and awareness to DC youth? And I wonder if, Natasha, you could take that one to kind of start us off, since I know that's a big part of what you do each day. If you can share a little bit about best practices there.
Yeah, it's getting out there and having those tough conversations. I think that it's important that we build our relationship with the community and just change that narrative of how we see young parents. And instead, when we meet the young parent, we think about what do we want them to learn from this experience with us. So it's about having those conversations about mental health and maternal health. Be creative and get out there on social media and advertise and find out where your core population is gathered, and just going out there. A lot of our services are outreach services and community-based services. So just having presence in the community is vital so that the young people can make that connection and get those services.
Got it. And Maddie, do you want to add anything there in what you're seeing as effective ways to get the word out to youth?
Yeah, so it's always a little bit hard, especially with high schoolers, because we only care about things that directly affect us, which is kind of frustrating when we're trying to do bigger social justice work or anything like that. But I think, like Natasha said, social media definitely, because I don't think we realize how much we absorb from social media until we're asked about something like an hour later. We're like, oh, I saw that for like 30 seconds on Instagram, you know? I think like YouTube ads, things like that. Just thinking about how you normally get all your information, like on the news, the radio, just putting out information like that and make sure it's getting to all wards in DC. Because I know Ward 7 and 8 tend to be left out of the mix a little bit, which is very frustrating. Because that's where there's a high concentration of Black and Brown people there. And that's why there are so many maternal mortality outcomes in that region. But I think definitely social media and advertisements would be the best bet.
I love that you were honest about, we don't care about something unless it directly impacts us. That's awesome. And actually really great insight. Kaneyce and Yusuf, do you have any ideas? One thing I want to really just point out is that I think young parents are even more difficult sometimes to reach for tons of different reasons. One is just like not having the time necessarily to devote to even perusing social media as much as other young people who don't have children, or if you're dealing with housing insecurity, it's all consuming, and so you may not have time. You may not be showing up for school, or lots of different things. So, any advice for how to reach young parents with these critical resources?
I don't have anything to add to that. I'm not sure.
Okay, that's totally fine. One thing I can say, I would echo all of the things that Natasha and Maddie spoke about in terms of ways to reach out to young people with this information. The other that I would add is really just getting the word out in terms of partnering with other organizations. Generation Hope has worked really hard over our past 10 years to really connect with other organizations that are doing great work, that are supporting the population that we're trying to reach. We go out and we provide free workshops and trainings on site wherever we can find young parents. It could be at a homeless shelter, it could be at a church or a social service agency, as a way to help them in their efforts and in their mission, but also as a way to get in front of the young people that they serve. And so I can't say enough about just the importance of leveraging those establishing partnerships. And leveraging those partnerships so that other organizations can complement your efforts in getting the word out and trying to reach young people with that information. And I think also the medical community, we can definitely do more to partner with providers in getting the word out about the programs that we offer. So those are two things I would add. Another question came in, and this is speaking of beef that Yusuf mentioned, not the beef you eat, but the turmoil or tension beef. One of our viewers has a question about whether access to relationship counseling or family coaching would be helpful.
See, this goes into a whole nother topic, because it's like with Black families, therapy, sitting down, talking about our feelings, like that's kind of like, what is that? You know what I mean? I'm down for it. By all means, I am down for it. But I've tried in the past. I've tried, and it's like, no, that's crazy. That's insane. Why do we need these people? Who I want to outside to come into our business? And it's like, you're thinking about it from the wrong perspective. It's not someone's coming to judge you. It's someone that's coming to mediate the situation. Like I've tried it. And once again, we're not there yet. Like I'm optimistic for the future. Hopefully we come together and, we're able to sit down in therapy and discuss these things. But as of right now, that's not even on the table.
I hear that. I totally hear that. I think similar to mental health supports, there's a stigma around counseling in general, whether it's for mental health or if it's for mediation, that is hard to overcome sometimes. And one thing I will say at Generation Hope, I think we've had some success with both mental health and just conflict resolution, in that we really build trust with our students. So our students are with us for up to 6 years as we help them get their college degrees. So I think building trust goes a long way in your ability to have a young person participate in any kind of counseling and therapy. And we've just found that to be really effective. Anybody else want to weigh in on the therapy or the mediation? Okay, so we have another question. What is the most critical support you need right now? And what critical support would have been important for you that should be available for other youth in the future? So I know we talked about housing as being really, really important. Is there any other critical support, particularly right now, even in COVID-19, that has been really beneficial to you?
I need green. I need dollar bills. That's what I need. Like
Got it.
COVID kind of messed up my whole, boosting up my salary and all that. So it's definitely been a struggle. But if anything, critical money, a sense of just peace as well. Being able to go to a destination and be like, you know what, I can cut my phone off. I can leave social media behind. Let me enjoy life. Let me enjoy nature.
I love that. Both of those. I hear that loud and clear. Kaneyce, I saw you nodding your head.
I was agreeing with Joseph about our economic situations right now, because since COVID-19 started, trying to pay for school, my car note, car insurance, and save money to try, for my time coming up, and then from the Social Bruce Transitional Housing Program, it could be very overwhelming. And right now, it's kind of like DC has not decided on how they're going to really help us during this time. So the wait is frustrating, but I feel like the more we reach out and the more that we show that we deserve to actually be helped during this time, I think that it'll work out in the end.
Yep, absolutely. And I think we're seeing the same thing with our students. Just the ability to pay bills and make ends meet is the most immediate and critical need right now. So 100% hear that. Natasha and Maddie, this next question would be great for you guys to weigh in on. What organizations should we consider getting involved in the focus on maternal health and birth equity?
I think that we're doing a great job collaborating with each other. There are so many nonprofit agencies, youth-led agencies, or initiatives that are taking place. And so I think that we should continue the good work and having discussions like this in places like this where we can come together and network and collaborate and look at our challenges and see how we can go forth and fix them. So, just to name a few, Sasha Bruce has a lot of different programs, and we're really in the community and engaging about health and maternal health and mental health, as well as New Generations, Nicole, and all the others. So I think that it's really at our fingertips, the information, and that we should just go out there, be comfortable, and see what's in our area, what services are being provided, and go to those community centers and to those churches and ask how they can help, because I think we're doing a great job.
Yeah,
awesome.
I think we also have to remember to keep all of these social issues intersectional. So including resources for disabled girls of color, for LGBTQ plus girls of color. I think keeping all of that in mind, because I know sometimes we just think either low income or non-graduated from high school, things like that. But remember to intersect all of the identities, because there are a lot of marginalized groups out there within the people of color. So I think just remembering to keep those in mind and then partnering with those organizations that do specifically target those groups would definitely be really beneficial.
Yeah, no, I totally hear that. And I think when we think about it, the intersectionality, it almost broadens the group in terms of how many different organizations should and could be coming together around maternal health. So that's a really great point. Another question for Kaneyce and Joseph: as young parents, would it have been helpful to be able to access all services that you needed in one place? So for example, mental health, prenatal care, applying for social services, as opposed to going to different places?
Thinking back on it now, no. And I say this because I wouldn't have met all these wonderful people and been introduced to all these various programs. Yeah, no. I mean, obviously I understand the bigger picture, someone would love to have that in one place, but in my case, being able to go from Columbia Heights, LAYC, over to Michigan Avenue, to Generation Hope, all the way to Virginia, to, Cactus. Yeah, I don't know. I love traveling. I love going places. So it doesn't really make a difference for me.
Got it. Kaneyce, anything you'd like to add?
I agree with Joseph. I feel like the more even though transportation is a problem for some, those people, they might would like to go get everything knocked out in one place. Me, transportation isn't an issue for me. So meeting the different people that I've met, through my journey has been great.
Got it. That's really insightful. I have one more question for you guys, and then we'll close out. And really quick, if you could tell us what is giving you hope right now. And we can start with Natasha.
Oh, wow. That's a big question. There's a lot in the world. So what's giving me hope is just my family and the work that I do. I absolutely love working with the young people and young families and just being that support system and being able to see how they benefit short term and long term. That's what gives me hope, to hear those stories about how they've overcome or they've accomplished something, or just that feeling of being, accepted or a part of a group. That's what gives me hope during this time.
Awesome. That's awesome. Maddie?
I think just seeing a lot of kids in my generation really starting to speak up against social issues that I know I have been well aware of for my entire life, but definitely seeing people from non-historically marginalized groups starting to speak up against Black Lives Matter and everything like that, that's really giving me a lot of hope. And then also I'm applying to colleges right now, and
Yay.
that's a fun but stressful process. So trying to think about what I can accomplish in the future and how I can help people is giving me a lot of hope as well.
That's awesome. Joseph? Uh-oh, I can't hear you, Joseph. I don't know why.
You hear me?
Yes.
There we go. Phew. All right. There's so many responses. What's giving me hope? I guess I'll be simple. I can't be simple. I'm trying to think. All right. What gives me hope is people, honestly. We live in a tough environment. I can't even say tough world because it's like the people make it what it is. But right now, with Black Lives Matter, with just social justice being like the forefront of just everything from video games to entertainment, it's just, I don't know, like even chaos gives me hope, sadly. Like I encourage everyone to go out there and vote, because this is the year where it really matters, because you can't deal with another 4 years of that orange. We just can't. So I would say, to wrap it all up, what gives me hope is the hope and the actions of people who believe that, we deserve more. We're equal. We're not lesser than, greater than, we're equal. So it's the best way for me to put that.
Thank you. Thank you. Kaneyce, you'll be our final response.
Outside of my children being my daily motivation, I could say that waking up every day gives me hope, because the way that the violence has been going on in the city lately, you could walk outside and a bullet just hit you nowadays. You don't even have to be doing anything wrong. You could just walk outside and anything could happen. So making it back in the house safely is what gives me hope. And knowing that I'm working towards the bigger picture for my future is also making me continue to push harder, because I can't have my young 3 boys ending up in the streets. That's not going to work out for me. So that's it.
Got it. Awesome. Thank you all so much for being on today's panel. And I hope you know that you guys are giving others hope by sharing your experiences and insights today, including me. So thank you for the good work that you're doing. Thank you for your persistence and perseverance. And thank you all for joining us and being a part of today's session. We appreciate you.
Thank you for having me.